to this muscle is important in determining the final long-term result. The implant can be placed in front of the muscle. However, most surgeons choose to place the implants under the muscle, which is often referred to as a subpectoral placement. It is important to note that an implant placed under the muscle is never completely covered by muscle, with the lower part of the implant extending below the lower border of the muscle. A standard subpectoral implant placement is often referred to as a dual plane type 1 technique. The placement of an implant in a dual plane type 1 follows several steps. Firstly, an incision is made in or near the lower breast fold. The lower end of the pec muscle is identified and then detached from the chest wall at the lower end to make room for the implant. However, as the muscle remains attached to the overlying breast tissue, it doesn't retract or move too far. A space or pocket is then created under the pec muscle large enough to accommodate the chosen implant. Once the pocket is created, the implant is then inserted and positioned, and the wound is closed. Depending on the person's natural anatomy, in the early stages after surgery, the lower breast curve or underboob can sometimes appear very tight and flat, sometimes even having a slight groove within it. This groove is referred to as a double bubble. As the breast softens and the implant settles, this usually goes away. However, as the muscle remains attached to the breast tissue and close to the lower curve of the breast, then as this muscle contracts, it often pulls the skin in, causing a groove along the lower breast curve. This is referred to as a dynamic double bubble and is quite common. Another form of under-the-muscle implant placement is a dual plane type 2. In this situation, many of the surgical steps are the same as a dual plane type 1. An incision is made at or near the lower breast fold. The lower end of the pec muscle is identified. But unlike a dual plane type 1, the breast tissue is detached from the pec muscle approximately up to the level of the nipple. The space under the muscle is then opened and the lower end of the pec muscle is detached from the chest wall. Because the muscle is now detached from both the chest wall and the breast tissue, this segment of the pec muscle retracts upwards. With the undermuscle pocket created, the implant is inserted and positioned, and the wound is closed. The dual plane type 2 implant placement results in less of the implant covered by muscle along the lower half of the implant, and this can have the benefit of a fuller, more curvaceous underboob. It also significantly reduces the potential for a dynamic double bubble, as this muscle is no longer close to the skin along the lower curve of the breast. One of the negative issues of a dual plane type 2 approach is that the detached segment of muscle is no longer functional, so you can expect a slight reduction in pec muscle function. However, for the majority of people,